Yeah, we are recording. So I think we'll get started. Welcome, everyone. So those on the line, we know we've got Lisa with us. We have Lois, hello, and we have Matthew. Who else do we have with us on the line?
It's Sarah for Lois. Lois is on vacation.
Oh, that's right. You told us that. Thanks, Sarah. Hi.
Hi.
Anyone else? Okay. So let's move on. Thank you, everyone, for coming. This is really great. We've got a lot of really neat stuff to tell you, and we're glad that you could all come.
Can somebody, I'm just going to make a proposal.
Sure.
If somebody could call and see if you can get Mark online. Mark, oh, sure. Can you try and get Mark online? Mark, because they had asked for this as well.
Okay.
The Quebec Mark. Mark.
Mark with a C, yeah, not Mark with a K. So, just sort of to start things off, the way I see things, I look at our organization, and we have sort of, there's the group that raises the money, and then there's the group that allocates or spends the money. You know, we've got all the fun, there's other departments. I know there's, you know, the communications, accounting, and whatever. But you talk about, you know, we spend the money for the research programs and the healthcare programs. The way I like to think of it, we have our research programs. We've got, say, you know, we've got Joanna and the great group in there. We've got Sandra and Tanya who work on the research side of things. And the way I see that, that's kind of for the future. The research programs are for, you know, the results that will be coming a little bit down the line. The healthcare side of things, so with the healthcare, of course, there's Denise, myself, Vanessa, and then we also have the privilege of Anshali with us in the patient advocacy side of things. But the healthcare, that's sort of the programs that are for the patients living with cystic fibrosis right now. So we think about how we support our community. We do the research for the future, and we have our patients that we're working with right now. So we've got it set up this way because we'll be flipping back and forth between our website and the presentation, so we can't make it full screen. So there we go. So why this session? So there's been sort of a push in the past, in recent past, to move away from paper. We've had a number of brochures. We've had a whole lot of information that was prepared in different categories over the years that we would, you know, distribute and so on, in an effort to consolidate all that and to sort of reduce some costs in terms of, you know, production and shipping and all that kind of thing. We've moved everything more towards our website. That also gives us a more comprehensive site. It gives us a more comprehensive repository of information. And it's also a way that we can ensure that everything continues to be up to date. So, I mean, we used to distribute pamphlets and brochures and so on. Well, then they can be outdated, and people could still be using them so that they, in fact, were, you know, distributing misinformation or old information. So, for example, if you were speaking to, say, a potential new donor who wanted to know general information about cystic fibrosis, that's on our website. If you were speaking perhaps to an anxious new parent whose doctor has just suggested their child go for a sweat test, what does that mean? That's on our website. Or if you were perhaps talking with a new chapter volunteer who wanted to know where clinics are located in their region, that's all on our website. So the purpose of today's discussion was just sort of to let you know what's available on the website with respect to the healthcare programs and how to find it. So the general information of healthcare, we talk about sort of, we were in discussions in preparation for this presentation today, our department, we were talking about one of the main questions that we seem to get are about diagnosis, obviously, and then fast forward 17, 18 years, transition to adult care. Those are two pretty significant events in CF care, but we also thought, well, to expand on that, what about, you know, life after transition? So there are all the issues that develop in adulthood. So I just wanted to take a minute and discuss those three areas. For example, when you're talking about diagnosis, what are the things that sort of come to mind with diagnosis? Well, there's the sweat test. You likely have all heard of the sweat test, and what is it? Well, it's really quite a simple test. You know, there's a little bit of this chemical solution they put on the forearm. There's a little plastic disc with a little capillary tube. It collects the sweat. They send the sweat off to a lab. It's analyzed for the chloride levels. That's, I mean, obviously the implications are much greater, but it's a very simple test. What else about diagnosis? Newborn screening. We know that Angeli has had some tremendous successes with getting newborn screening into almost all provinces in Canada. What does that actually mean? Well, every child, almost every child who's born in Canada has the little, the heel, or the heel prick, the heel on the foot. Takes a little blood test, they send the blood off, it's examined in a lab for a series of diseases. So our efforts to get newborn screening in Canada simply means that cystic fibrosis is added to that list of diseases to be checked for. Sort of sounds like a simple thing, but we know that that's been, there's been tremendous provincial government resistance to that, and we've had successes with that. What else about, diagnosis, late diagnosis. That can be a very big issue. And interestingly, we've heard a couple of anecdotes, this past couple of weeks of people who have known people diagnosed with cystic fibrosis later in life. What does that mean and how has that happened and so on? Those are things that we think about with the diagnosis. Transition to adult care, that's a really big deal. You think that someone has been going to the same pediatric clinic since hopefully a very young age. They know the team members, they know the whole process, they know where to go in the hospital, they know to call when they need more medications. Well, suddenly, at the age of 18, pediatric institutions can no longer admit what's going on back there.
Sorry, Ian. We spilled a messy coffee.
Damn.
A lot of coffee cleaned up. Sorry.
So pediatric institutions can only admit patients up to the age of 18. So therefore, the cystic fibrosis population has to transition to an adult center. So it's a whole new environment, it's a whole new series of processes, and suddenly these young adults are feeling a bit abandoned. They don't know the processes, and plus two, it's an adult center, so the parents don't necessarily come with them anymore. So this can be a very difficult and traumatic time for those who are transitioning. Now there's the other side of it, of course. We've got those who are thinking like, oh, God, I don't have to go to that stupid place anymore, that dietitian who I hated, and Mickey Mouse pictures on the wall and the baby furniture. Maybe for some it's a new beginning, and that's terrific, but for a lot of people that's a very difficult time. And lastly, the adulthood issues. We talk about, in the general population, as you age, there are certain complications that ensue as you get older. Well, it's the same with cystic fibrosis, but because of the CF, that tends to be a bit more complicated. So now we're looking at things like cystic fibrosis-related diabetes, which typically happen, in later years, osteoporosis and menopause and CF, that kind of thing. And there's completely different issues. In a pediatric center, you're talking to children about teaching them how to take, but in an adult center, you're talking about, fertility and stuff. It's different. It's almost as though adult CF care is it's like it's a new disease. It's a different disease. And we know now that half of our population is over 18, so that's a huge chunk of our care. So now let's move to the website. Out loud. Okay. You'll note there are 9 up, and Joanna's here, and I always like to make fun of, the research programs. Ours is so much more interesting. Not here, but you can tell her that of the 9 tabs, 2 of them are with respect to the healthcare programs, but only 1 is with respect to not that we're counting. But so there are 2 tabs here. CF care. One you don't need. Yeah. So we have 2 tabs. We've got CF care, and we've got about, So if we go into CF care, check it out. Is that, that's the healthcare programs. That's okay. This is the healthcare programs, right? This is the stuff that I'm always harping about. And you guys are like, God, does he ever shut up about this stuff? We've got, quality improvement, accreditation, the registry, all that kind of stuff. So what this tab is, this is how CF care is delivered in Canada and where, and what Cystic Fibrosis Canada does to support that care. So, for example, we've got how CF care is delivered, and I'm just going to touch on it. There we are. So how CF care is delivered. So we talk about multidisciplinary care. You all know about that. We talk about the clinic incentive grants that are, going to support the personnel to make sure that care is available and so on. And we've also got down at the bottom here, look at this, CF clinics. So we can pick a province. We can say, we can pick a province. It's a joke. Okay, this is the irony. I'm like the least technologically minded person you know, right? I'm the last person I know who does it on a cell phone. Look at me doing this. Okay, look at that. There's IWK. There they are in Halifax. Check it out. So this particular tab is all about, the grants and clinical care and so on. And Then you go back, we've got a page for accreditation, so that explains what the accreditation program is, how we're supporting the clinics to make sure that care is, consistent across the country. It's accountability on our part to make sure that the money is going where it should be going. We've got the discussion about quality improvement. So this is the program that we launched a couple of years ago. It's giving clinics some tools to help improve the quality of care that they're already delivering. And we also have the registry. So I think that's about all I wanted to say. So I'll pass it over to Vanessa Narskowski, who will be talking about CF Care, about CF, and probably tell you if I've lied to you.
Thanks. Okay, so under about CF, you'll see a little bit. You can see what is CF and then living with cystic fibrosis. So I'm particularly bringing this up because you're going to have questions, or you have had questions from donors. So I want you to understand how this section works. So it's divided up into some general categories: infection control, introduction to treatments, and there I have all the physiotherapy treatment. So the physiotherapist group got together, helped me produce this. I'm just going to show it to you. So we had 5. All the different therapies. There's pictures so you can understand what the therapies are, which may help. And then there's the controversial, a little bit about exercise. And this is just, I put it under a generic section so that all age groups could actually access it. Which brings me to the next point. The rest of it is then divided up into, age groups. So the reason that it's just the 4 age groups we talked about is newly diagnosed, school age and toddlers, adolescents, and adults. So under this section, so let's go to toddler age. So under this section, there are the specifics about what's going to affect this age group. So things like school. School is a huge thing for these parents and for these kids. How are we going to ensure that they get the care that they need once they're away from their parents? So this is one of the resources that has been in CF for a while. It's been revised, and you can access this on the website. There are several points where you could access all these resources, which I'll show you. So this is one. So this is just a pamphlet that we actually will provide, or the parents can print off. It's one of the 4 that we have kept in print. So some of the clinics will have access to it, but equally all patients, all advocates can access it on the web. And then for all the sections, I have a little bit about nutrition, which is important, and how that relates to the different age groups. So here we're introducing really the enzyme, and then some things that affect this age group, which is blockages that can happen. Yeah.
One under newly diagnosed?
You want to see it? I can see that. Very helpful.
This is newly diagnosed.
So going into a little bit about how that can affect the parents. Obviously, this is a time when it's most shocking for these parents. This is where also we talk about, actually, I should put in here a little bit about the kits now that they're a part of our program. It's not there.
About the caregivers, because obviously what I've heard, and the REDs have also shared, and at the clinic visits, is when a family first hears about the diagnosis. Obviously, it's a very difficult time, and one of the things I know we're not giving materials out necessarily, but we do have the kit, but not everybody gets the kit.
So this is actually a topic that we're trying to understand of who gets the kit. I've never asked this question, and now I'm doing a little bit of a look across Canada to understand how are the different clinics handing out these kits that are only few.
Right.
And so really we're giving it to pancreatic.
Because I'm hearing 2 things. I've heard some say, well, we wait till the second visit to give the kit, because the first visit they're just dealing with the new information, but at the same time, it just made me think that it would be great if we had something, or guidance to the clinics or through a tool or whatever, that just directs them after that first visit to go here, like, to gather information. So if they could leave with something, be it, I don't know what that could, doesn't have to be complex or anything, but that the nurse practitioner or whoever is counseling says, go here, there's going to be information to provide you more information, more guidance, more details.
Okay.
And so I just want to throw that out at you.
For sure.
Okay, yeah. So I just want to show you one other section.
The other question I have is, do we measure on a monthly basis, like how many times a certain page is being visited? Like, are you looking at like CF Care? How often is that being visited? And about CF, how often are these different topics being visited?
That's a good question. I don't know. I don't know if we.
It would be interesting.
Do the council people do that?
We do have the ability to do it, for sure.
Yeah.
I think if you ask to talk to Nicole Cross, it's just a simple pull into MS, I think. Yeah.
Because that would be interesting to see, you know, how often is it actually being referred to on a, you know, quarterly basis.
Yeah.
So the other section I just wanted to show you is the adults. So it's not much on here, but the amount of information in each of these links is quite extensive. So in Ian's point, there is a section on late diagnosis that I added, and then a section on the complications that can affect these individuals. So I just wanted to revisit where you could actually access all of the resources.
I have another question. Do we have enough information for caregivers throughout I say caregivers or families? We do?
No, I'm just acknowledging what you meant by caregivers.
Yeah.
I think it all is in that direction, but I don't know that it necessarily is.
Opportunity there.
Yeah.
Okay.
Yeah.
There's always opportunities to add things. So here's the one page where you can see all of the different resources. So all of the pamphlets that we do, all of the specific nutritional information that's found on the website. So if you needed something to give to a donor, that's where you would go to find out. So I just want to also share with you, so the 4 pamphlets that we actually decided to keep in print, how we came to this was not me haphazardly deciding. I went across Canada and understood what was being given out most of the time, what they were running out of most, and we just kept those. So one's CF in Canada, which is probably most appropriate for many of you. The other is teen sexuality, because as teenagers, this is a great piece. Although the reason that we went more on the web is because most of our generation is accessing things on the web, plus keeping it up to date. Your Child in CF, which is a great new diagnosis one that we give out, especially in the kit, and then, as I mentioned, the education one. If any of you want to look at these, you can. Yeah? Sorry.
Now, they are shipped to the clinic? What happens here?
Yeah, so all of them have a certain amount has been shipped out. I do still have quite a few under my desk. Coming up with numbers was a bit difficult, so we're in the transition of trying to understand what is being handed out each year, and then from then on we can start providing that number.
And how do you know when they're out of product or out of...
They would let us know.
Pardon me?
They would let us know.
They would let you know?
We used to have actually an inventory, and we'd keep it at the warehouse. That's how many.
So out of the 42 clinics, they would contact you, or how does that work?
Yeah, that's not being solidified, but that's how it's been working.
And out of the 42 clinics, how many would actually be asking and refilling?
So far, I could say half a dozen.
Half a dozen, only about 6.
Yeah, not many people have run out yet. So the problem with the clinics is we used to keep these pamphlets out in the waiting area, but no longer are these patients going to be sitting in a waiting area. So it's up to the nurse to provide them with it. So that's hence why we're going onto the website, because if a nurse forgets to give it out, the dietitian forgets to give it out, then they have access to all of it on the website.
Maybe on the more recent, track the numbers of people visiting, accessing the pages and downloading, because you would expect to see that to go up if the distribution to the clinics goes down.
Okay, so last and the best part is to come to the registry. All right, so here we go. The registry, I'm just going to talk about 4 main parts of the registry. So as you know, every year, annually, we publish an annual report about aggregate summary statistics on the registry. Are we okay?
Yeah, we just had a hand raised here.
Oh, sorry, there's a question. I'm sorry. How do you?
I have
Hello, your question from Lisa? Hi, Lisa.
Hi. Just I know this information is very useful for clinics, but we also at the chapter level, I don't know if there are any other chapters represented, but or any other regional offices represented on the call, but we do get requests for this, so having access to it in some sort of a hard copy is not a bad thing, just to add a little bit to that previous slide there.
Yeah, I would agree. You're right, Lisa. We do get calls on a fairly regular basis for these families. Most of the time they're just calling, I have all the CF information now. How do I give? How do I get involved? How do I engage? But they are asking for information. If they've missed it at the clinics, they do ask for this type of thing. So for sure. That's a good point, Lisa.
The other place where we, it's not, and we do get it and people do want it, there are specific areas. If we're setting up an information booth, we need something that is printed, not just a website. It adds validity to what we're doing, so just a little plug there for paper. I love trees too, but let's kill them.
We developed all the brochures that they could be PDF printable, and at one point we were instructing the clinics to, visit the website. People who had a need to hand out paper materials, they could print it off from our website. But
yeah, the problem with that is, and I agree, it's a great resource. Even for us to print them here, they don't look like they're legit. They don't, depending on how people have their print drivers and stuff set up, it's not that simple. Just a little plug there. They end up looking like they're done by a 5-year-old who could probably do them better. So it's not having a printable PDF. You can print it there and you can see what it should look like, but I've seen what the clinic here prints and it's not great.
Good to know. Okay, thanks, Lisa.
Just a little insight from the field.
Yeah. Okay, any other questions? We're good? Okay, back to the registry. All right, so as I was saying, every year we publish an annual report here, and the most recent one is 2013, so just to let you know, we're always a year behind. So while the calendar year for 2014 has finished, nurses have not finished entering the 2014 data, so we're always a year behind. So 2013 is the most recent, and in the report you will see, and I'll just open this. Okay, so in the report, and a lot of you come to me for numbers and such, happy to help out, but if you were in a time crunch or whatnot, there is a highlights page which gives out, I guess, a brief overview of what's going on for that year of the clinic population. So what it is anybody who is seen at a CF clinic across Canada would be included in these numbers for 2013. Okay? All right, so then that is the registry. And then next we have a question and answer section, which we took a lot of inspiration from the CFS website, and it talks about the data and what is entered in the registry, and in terms of consent, and as well as confidentiality, and how questions about which ones are the top CF clinics. How do you answer those kind of questions? Why you might not necessarily want to move to where the top CF clinic. What does that mean? And other things like that. So take a look and see if those help you understand the registry's data. And then next we have a section actually on clinic-specific data. So this is new since last year. So for 2012 data, as part of CFC's mandate for full disclosure, on clinic-specific data, we have made available 2 health outcomes, the 2 biggest measurements when you look at the pulse of a clinic, which is their lung function and their nutritional status. So here, which looks similar to the overall clinic map, you can again choose a clinic, and here I'll just choose a big one, let's say sick kids, for example. And here you will see for sick kids, their average clinic-specific lung function and nutritional status as compared to any other year. So 2012 and 2013 are available now, and it's compared to the national average. So pediatric clinics are compared across all pediatric clinics nationally, and then adult clinics are compared nationally across national adult average.
What about combo clinics?
They're split. Combination clinics are split between their adult population and their pediatric population based on age. Thank you. Good question. Absolutely. All right, and then there's some explanation of how that number is done. That's all stats if you're interested, but they are done with some statistical help.
What's the benefit of showing this?
Oh, good question. Thank you. So the big benefit is, for full disclosure, is to improve communication between the CF community, the patients, and the clinics themselves. So as you know, we are part of the Quality Improvement Initiative, so this also helps guide and hopefully inspire them to look into quality improvement measures in their clinics.
The whole idea of the clinic transparency for data was not punitive, and
yes.
There's a whole lot of discussion leading up to that for fear that it would be perceived that way. But ideally, it's to look at, to give a clinic an idea of where there's room for improvement. And I don't think there's been any concerns that, like Denise sort of alluded to, say a parent is going to look at this and say, oh, well, the clinic that I go to's got really bad outcomes, so I'm moving, across the country with it better. We've had very little, I don't think we've had anyone look at it that way. In fact, I think the clinic population, the people who attend the clinics, actually take a bit of ownership in this and think, it's almost a bit of an incentive to see how they can help their numbers get better. So it's to say, looking, for example, at this, well, they're kind of a bit negligible, but, there's slight improvements and that kind of thing. It gives a clinic way to look at
where they're moving forward against measurement.
Exactly, things that they could strive to make.
Okay, thank you.
Would there be any benefit to showing how many patients attend each of the clinics? Because we provide that number all the time when we're seeking funding.
Yes, you do. You do have to do that a lot. That's true. Good point.
and I mean, if you look at all the clinics.
Scroll down.
Yeah,
because I see it, so it's right there.
Yeah, it's right here. It's for the year. Yeah, it's right here. Do you see it on the?
Oh, okay. Yeah, I see it now.
Yeah, it's only for the year though. It's only for 2013, for example.
The most current.
The most current, yeah.
No, that's great.
Yeah, it's
an indication of what.
Yeah, there you go. Yeah, fair enough. Thank you. And then last but not least is a new little thing that we added to the registry, which is requesting data. So as you may know, we once in a while get requests for data, registry data, for research and clinical studies. And so this is just a section specifically added so that everyone is aware that there's a standard process involved with requesting registry data. We have a registry review panel that takes a look at the application form, which is available here. They review it and they make recommendations, and there's a score sheet. Nothing as hardcore as the research team, but something very similar, so that we can get data out there and help people participate in studies and such. Okay, that's it for me.
Do we charge for that?
This is an opportunity moving forward.
Yeah, okay.
There has been, obviously.
We have. Typically, if you're a clinician in Canada, then we don't. But if you're outside our community, as well as your industry, then yes, we have charged.
I see that we're very good at getting most things translated. The application form is just in English.
It is.
Is there a reason for that? I mean, there's just no demand.
Yeah, well, I think also because all the data is in English, too. All the registry data is in English. Yeah, we haven't had I'm looking at the history of requests. There's never been one from Quebec or French.
Maybe because it's not translated. Yeah, we have to be very, very.
Yeah, absolutely. Yeah, I did think about that when I spoke that I did. Yeah. Fair enough.
So, thank you, Denise. Thank you, Vanessa.
Andrea, Lisa, who are on the line right now. I think the chapters would really benefit from this presentation.
Sure.
Or the chapter president. I don't know, what do you guys think? I think this would be a very good, thorough review for them to see, because they can share it with their executives and their volunteers as well?
We would be happy to do that. We've also been recording it.
Yeah. Yes.
I was just sort of going to close by saying that very thing. There will be the link. We'll distribute that when it's available, and we would love for this to be, spread across the country. We were hoping to have a lot of participation, so thank you everyone for coming today. I'd like to give the plug for the healthcare team. I feel so fortunate. I've got Vanessa and Denise and Shalid. It's like, the Charlie's Angels. Thanks for everything, and thank you everyone for coming. As we send you off on your, your little lunch hour, you can have healthcare programs, visions of healthcare programs dancing in your head.
And I just want to compliment Ian here too and the team, because this came about when the regions had shared, we want more information about about the clinics. The clinics are asking for more materials, and one of the things was, know what's available. And this is where you all came together and came up with this great idea of presenting this as step one. And I want to compliment you all for this, because it is an education, an ongoing education. And I think there's an opportunity. I wish that, I have to say, I know a few members of the REDs are not available. And it'd be great to, if you have the opportunity, reach out to the ones who did not participate today and share this with them as well.
Can I ask, is there time for one more question?
Sure. You're in line, Lisa. Shannon's first, even though you didn't know that.
It's not a question. I just want to tell you that I was speaking yesterday to a newly diagnosed parent. His daughter is just 2 weeks diagnosed, and he specifically commented on our website at how great it was.
Really?
And he said that he spent most of the time in the resource section.
Terrific.
He specifically said it. So you guys are doing something right. So congratulations. I just wanted to share that.
Thanks very much.
Yeah.
Lisa?
It was Andrea, actually.
Oh, I'm so sorry.
No, that's okay.
Oh, my God.
That's okay.
I'm just dragging Lisa's name through the mud. Sorry, Andrea.
So one thing that we do in a number of the regions is provide waivers to the clinics so that when parents go in, they have the option of signing this waiver that says that they're willing to receive information from their local Cystic Fibrosis Canada office or chapter. I'm wondering if we could put something like that right on the website, where if they're looking through the information and want to receive something from us, they give us permission to email them. Because we're kind of reliant right now on the clinics actually handing those out.
Sure.
That's a good idea.
That's a good idea.
That's a very good idea.
Thanks,
Amen, sister.
Good.
Hey, listen, we all get together, and all of us together come together with great ideas. So that's good.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
Thank you.